What were my 5 specialty ICUs when I was in float pool? Let's get into it. So, as I've mentioned before, I started off in a liver transplant ICU, and that is a very specific patient population, and things are done very differently. For example, up until I left the liver transplant ICU, I had never hung any fluids for blood pressure besides albumin. Like, no LR, no plasma light, nothing. I was like, okay, if I want to travel, I need to get out there because this is very different than all of that, and I need to see all of that so I can gain confidence and get out here and travel. So then I stumbled onto float pool ICU, and I started off with orienting in the medical ICU. And the medical ICU is, well, now it's really COVID land. That's where all the COVID ICU patients go, is the medical ICU. Before that, it would be like your pancreatitis patients or your diabetic ketoacidosis patients or your pneumonia patients. Really, anything that's heavy in medicine would go to the medical ICU. Then I was trained in surgical trauma, which is what I'm currently working in now on a travel assignment. But that is basically like gunshot wounds, car crashes, anything traumatic, falling off a ladder, firework explosion, that type of deal. And luckily, because I had worked in liver transplant already, I understood how to take care of surgical patients because they have like a lot of drains and Doppler checks and all that stuff. The neuro ICU was like a lot of your stroke patients or brain tumors or gunshots to the head. At that facility, any gunshot wound that was from the neck up would be considered a neuro ICU patient. On my first day working in neuro, I actually had to go to FLOS, which is brain death testing on a young kid. I was like, damn, okay, this is what the neuro ICU is all about. Lastly, I was trained in the cardiovascular ICU. And it's not true what they say about CVICU nurses. Those are some of the nicest nurses I've ever met. They're so nice and they're so smart. Like, the rumors aren't true. Anyways, in CV, you would see a lot of, obviously cardiac issues, like if they had a CABG or extreme right-sided heart failure or left-sided heart failure, or if they had an LVAD or a balloon pump or things like that. So if you want to work in ICU, there are clearly plenty of options for you to go into. I personally love float pool just because I feel like I was able to really expand my knowledge base, understanding how to take care of all these different types of patients.